Welcome to Negotiation with Alice, your negotiation podcast. Everything that you do where you need to get on the same page with someone else is a negotiation. So whether you have to negotiate a contract with someone, or you simply need your boss to sign off on that program that you'd like to implement, or you want to figure out how to rebalance the chore structure in your home, or talk about what vacation you want to go on. All of these things are negotiations. So in my podcast, we go over both personal and professional conversations, which all are considered negotiation, and I will give you tips on how to come out ahead. Welcome to the show. Welcome, listeners, to another episode of Negotiation with Alice. I have a special guest today because Rebecca and I share a lot in common. Not only the fact that she lives down in Louisiana, which is where I grew up, but we also are passionate about communication, conflict resolution. So we really connected and hit it off. So I'm very excited to have Rebecca Marchiafava here with us today. Welcome.
Thank you so much, Alice. I'm glad to be here.
Please tell my listeners a little bit about the work that you do, who you serve.
Yeah, so I just a few years ago now founded my business Culture Work. And so I consult with organizations around workplace culture challenges or ways they would like to develop and shift their workplace culture. But as you kind of mentioned or alluded to, I do focus a lot of that work around strengthening or opening up lines of communication with teams, providing workshops and facilitation around conflict. So that can be direct conflict resolution work, or it can be more of, supporting teams and identifying what do they want their conflict culture to be and sort of reflecting on that and building culture around that. And then also promoting well-being, and I lead culture assessments as well. So just again, sort of like various ways through facilitation, coaching, workshops, and consulting to support that sort of development for organizations and teams around workplace culture and workplace relationships, the intersection of those.
Awesome. I like to call it the people science, right?
Yes. The people matter, our relationships matter, and it makes has such an impact on org culture. So
absolutely. And I feel like with the rise of AI, communication is becoming more and more important because people are losing their ability to communicate in a way that doesn't land poorly or upset people. So I think that the work that you and I are doing is really important, especially now.
Yeah, I would agree. I think it's a really interesting opportunity to reflect on, what is really valuable about humanness and how do we, create these spaces and work on these skills to continue to build our humanness and build human connections, because the need for that will never go away, in my opinion.
Yes, totally agree. And what's interesting about our conversation today is even though Rebecca and I are both doing work in the workplace, we're actually going to talk a little bit more about the personal and advocating/negotiating for yourself. So Rebecca, take it away to introduce our topic.
Yeah, well, when we were meeting, to talk about potentially me coming on the podcast, one thing that we struck on was this idea around self-advocating in healthcare spaces. So advocating for oneself. You mentioned personal, one of the things about the work I do is I say, culture work is where, work meets well-being. And for me, this concept of well-being is really important. How do we promote health and well-being in our work, but also in our lives overall? And one of the reasons I'm so passionate about it is that in 2018, I was diagnosed with an autoimmune disorder. And I'd been kind of having symptoms and, not feeling super great for a couple of years prior to that. So really, it's been almost the last 10 years. This has just been a really big, facet of my life. And after being diagnosed, this was the first time that I really found myself to be dependent on, medical systems and healthcare systems in a way that I never had been before. Prior to my diagnosis, it had mostly been, preventative care and brief illnesses here or there, but nothing long-term or chronic. And so now it's like, okay, for my survival, I'm required to interact with this system. And that was a really difficult experience to go through, especially in the first few years after my diagnosis. So just kind of navigating, sort of how to, even though I consider myself an assertive person, that was just a big challenge to figure out, what is this line that I have to walk between advocating for myself and being assertive and not, being a problem patient for medical providers in a way that might compromise my care, right? And so I don't know, that was just a really interesting topic when we were discussing this concept of negotiations. And I know you and I both either have personal experience or know other people as well who have struggled with this question. So we thought Absolutely. It would be a worthwhile thing to discuss.
Yes, because I definitely have stories that I can share as well. But we first need to just call out the fact that a lot of times in the healthcare world, women are not taken seriously. Like, it's been documented. People of color are not taken as seriously, right? And so first we need to just call out what the bottom line is, and where we start. And so as women, we have to advocate for ourselves. And what you said is really important, that you don't want to anger the healthcare professionals so that they deliberately neglect you or take lesser care in trying to figure out what is wrong with you. So we wanted to chat today about ways that people can advocate for themselves in a healthy manner, in a polite manner, but still advocate for themselves. Yeah. So I want to ask you, Rebecca, sort of you mentioned you're polite, you don't want to push. So what did you do to try to get over that hump of not being heard by a doctor when you're complaining about certain symptoms?
Yeah, so I think for me, one of the things that was really important was talking to other people in my life about what I was experiencing and getting those other perspectives, because just like I think doing consulting work, it's really easy to look at someone else and be like, here's what I recommend you do. When it comes to actually navigating that situation, I know for me, I can tend to second guess or think that, well, maybe I'm being hyper reactive, or maybe this is a trauma response, in terms of my stress about this, and maybe I need to chill out. But in talking with other people, my friends and family, it was always really helpful to get those perspectives, to be told no, this is ridiculous that you haven't heard back from your medical provider's office in so long. And so, yeah, it's time to maybe be a little bit of a thorn in the side. Again, not in a disrespectful way, but just in the way of, okay, I am going to send that message again. I am going to follow up. And ultimately, what it meant for me was also examining, what are my expectations? What do I need? Because there was a situation where I had switched to a new provider, and in some ways, I really got some of the things I needed from this new provider. And in other ways, their responsiveness, their, the responsiveness in terms of replying to messages or actually developing a treatment plan, there was a lot that was lacking. And so then I was faced with, okay, I just made this switch and there was a whole lot, going along with that. When do I make another switch? And so I think we can also often talk ourselves down by saying oh, well, I could switch, but it's not going to be better anywhere else. Ultimately, I did make another switch and got into a much better situation. But I just look back on that as an example of, the ways that we can talk ourselves out of either advocating for ourselves or actually, taking the steps to make a change if we are not getting our needs met by a current provider.
And to make matters even more complex, then there's the familial, meaning with your family, negotiations about whether you're being too demanding, you're not being demanding enough, and they're all the opinions of the people who are close to you, whether they're your adult children or your spouse or your parents, saying, you need to ask for this, or you need to ask for that, or you shouldn't get this, or you should get that, right? So then there's all the outside noise that is sort of affecting your ability to go and negotiate and advocate for yourself with a healthcare provider, especially if you're hearing everyone else's voice in the back of your head,
I think
right?
that's a great point, because even for me to tell my story of, it was helpful for me when other people would tell me like, no, this is unacceptable. That was validating to me. But someone else might, get a response that's invalidating when really they should be, advocating for themselves more. So I think knowing your relationships and knowing the dynamics, and being able to decide like what is helpful and supportive, and yeah, what you need to tune out. Like you said, like just cut out that noise.
Yeah, I've had experiences where I don't know if it's because I was an Asian woman. I don't know, right? All I know is that I've had this experience where I've complained about a pain or some kind of ailment, and literally I was not taken seriously. Like, it's happened in multiple instances. So one time I had like gut issues, and it turned out that it was giardia, which is what you get when you go down to Mexico and drink the water and that sort of thing, right? So he gave me antibiotics, but he never followed up with me. And so about a year later, it came back. Like, I felt like the same strain came back. Maybe like he didn't get all of it. And so whatever was remaining came back. So I went back to the same doctor and I said, I think I have giardia again. He said, no, that's impossible. You're not going to get it twice. And I said, yeah, but it's like the exact same thing I suffered a year ago. And so then he argued with me and continued to say, there's a stomach bug going around. It's probably just that. And so I had to continue to say, please give me the test. Please give me the test. Because he said multiple times, I'm not giving you the test because I do not believe you have it. Now, one of the things that everyone really needs to take to heart is that you know your body the best.
Mm-hmm.
You may not be a doctor, you may not be a medical expert, but you're the expert on your own body, right? And I want people to really internalize that, because when you show up and you are being told by a doctor, no, you don't know what you're talking about, you're not a doctor, if you feel like there's some merit to what you're saying, you shouldn't feel like you need to just shut up because someone else who's a medical professional is telling you, no, I think you're wrong. Ultimately, under protest, he gave me the giardia test back and then came back into the room very sheepish and he said, you have giardia.
Wow.
Right?
Surprise, surprise.
Right. And then in the early 90s, I had Lyme's disease in the Czech Republic. And when I came here to get retested, all the doctors were like, there's no such thing as Lyme's disease. Oh, you came from a third world country. The doctors don't know what they're talking about. Like, I got a lot of this kind of messaging when I came back to the States.
Yeah, and I feel like, I mean, Lyme disease in particular is so often difficult to get a diagnosis for. But yeah, I mean, just those two examples. I'm so sorry those things happened to you. And yet we know, like you said, I mean, this type of experience is so widespread. And even it makes me think about when I was, I think, in high school, my mother was starting to have a lot of knee pain and in one of her knees. And she went to a doctor and he did not even physically examine her. He just, from across the room, basically diagnosed her with arthritis. And it ended up that this knee pain kept getting worse. And she ended up, I remember her crying on the phone, trying to get an appointment because the pain was so bad and no one was listening to her and taking her seriously to look into this more. And it turned out that once she did actually get seen and once they, really did examine the situation, she had a tumor underneath her kneecap. And
Wow.
so it was the same doctor. And yeah, again, I'm sure very sheepishly, or I think the way she talks about it is, well, now he's scared, right? Because this could be a potential medical malpractice suit. Fortunately, it was a benign tumor. But what if it hadn't been? I think, again, this is life and death sometimes that we're talking about. This is quality of life. This is our health. And that's just fundamental to our lives. And yeah, so that was an relatively early experience where, it's one that I think back to a lot now. And knowing that, yeah, it's still an issue. It's still something that we need to be talking about and working on.
Absolutely. And, one of the things that I feel like, in negotiating, especially when it comes to advocating for yourself, you have to at least believe in yourself. That's one of the fundamental things before you go and advocate. Because if you feel like, well, I don't know anything, I must not know anything, it's going to be significantly more difficult to show up with a medical professional, an expert, to say, hey, I think you're missing something, or I don't think that you're looking deep enough, right? And so I think that you have to at least negotiate with yourself first. That's your sort of prep, right? To say, I've done enough research about what's happening with me. I don't think the answer that I got is sufficient or okay, or, because everyone is different. And a lot of times, medical professionals, A, do make mistakes. And B, a lot of them are working off of patterns, right? Like, oh, you're on this age, you're having a knee pain. This is a pattern that I see. And so let me go ahead and diagnose you because you're fitting within the pattern.
Yeah.
And so if you feel like, oh, no, there's something else going on with me, I don't think it's in the pattern, you know yourself best. You're the only person who can advocate. And I've made the mistake in the past where they said, this is just getting old. The pain that you're experiencing is getting old. So then I just go home and just continue to live with the pain without realizing I should make more of a noise. I should go and complain some more until they look deeper into it, right?
Yeah. And it reminds me, so I publish monthly on my Substack, and one of the early posts that I made on there was the 5 health benefits of complaining. And to me, I even had, talk about like we have to talk ourselves up and kind of build our own confidence for things. I had to build my confidence to publish that because I thought complaining is so stigmatized, it gets such a bad rap. And yet, truly, there are various ways that complaining is essential to our health, to relational health. And so being able to give voice to the pain that we're experiencing, the discomfort we're experiencing, the ways that our lives are being limited by pain and illness, that's really essential. And I really am a big advocate for complaining in these situations and not being afraid to do that. But also I think recognizing that, even for people, if you struggle to go in, and I know I'm kind of calling back to the support piece, but if you have a support person in your life who can help you to bring things to the doctor or like help you to have those conversations in the moment, does it help you to have a person to come with you to provide that support and make sure that you are asking questions, and recognizing too that even the way the structures are set up can be very intimidating to navigate because a lot of times, and again, taking doctors' perspectives, healthcare provider perspectives, their schedules are often so, booked in such a way that they only have maybe a couple of minutes or a few minutes with you. And so, to try to even in that time frame, feel like you can advocate for yourself and get what you need from that, interaction. That's a really challenging limitation to navigate. So I think being aware of the ways that like, here's the way the system is set up, and it is absolutely imperfect. And here is, the best way that I can try to navigate this system and advocate for myself, even within those, restrictions.
Well, I love what you said about bringing someone close to you who can advocate for you, who can ask questions for you, because in communication, when we are feeling stressed, which I'm presuming a lot of people might feel stressed sitting in a doctor's office where it's not necessarily just one and one, meaning you and the doctor. It could be you, and then there's the doctor, and then there's the nurse, and then there's somebody else who does intake, and sometimes there is a resident, right? There could be multiple people, and then just you, which for many people can feel intimidating. It might make them feel shut down, and they feel like, well, I don't want to ask these questions because I don't want to either sound like I'm stupid or sound like I'm bothering them or sounding like I'm being pushy or sounding like I'm a jerk. And there are all these things that we might bring to the table. And so it's really an excellent idea to bring a neutral party, someone who cares about you, but someone who is not you, there to advocate for you, or at least be there to help you advocate for yourself. That sort of moral support.
Yeah.
Where either they can be the one talking for you or they can just be there so that you can have the courage to ask the questions. And you made mention of it earlier, but to like have a list of questions that you want to ask, right?
Yes, the preparation part of it, right? I mean, I think that is key. And it can help because like you're saying, I mean, it can be a stressful experience. It can feel rushed when you're actually in the appointment. So what do you need to reflect on and yeah, kind of document and get down to just so that you're not trying to, oh, am I asking everything? Like, no, okay, I have my list. I thought about this in advance and I'm, coming and we're going to go down the list and, get these questions answered, get these things talked about. Or yeah, here's my list of symptoms, making sure that I'm not forgetting to communicate anything because healthcare providers they need the information as well to be able to make judgment calls.
Exactly. Yeah, because, especially when you have chronic pain, like I do, you frequently forget that, oh, 2 weeks ago, this other thing happened and it got worse because it's sort of an ebb and flow, right? And
Mm-hmm.
so then you show up and you have a tendency to do recency bias, which is you tell them what happened the last 2 days without really letting them know what's been happening the last 2 weeks because you've already forgotten about it. So to at least sit down and think through it, document it, so that you can actually show up and give them an idea of what's actually been happening as opposed to like, this is me the last 2 or 3 days.
Yeah, no, I think that's so important. And I mean, I have a GI disorder and I used a literal app where it's like I'm tracking my symptoms and yeah, I think like you're saying, I mean, we can even when we are living in our bodies, we are the expert on our bodies, but like you said, we can have our own bias around, oh, well, I've been feeling better the past week, so everything's okay. Oh, wait, the 8 weeks before that, I was having the symptom. Maybe I need to bring that up. And
Yeah,
yeah.
yeah, because a lot of times with the chronic stuff, it is an up and down, and then we always seem to just forget and think like, oh, we're on an uptrend, we're getting better. So we focus on the fact that we're getting better without realizing if you look at the long term history, it's a lot of up and down, where you might feel great for 1 month and the next month it's back down again based on whatever's happening, right? So
Definitely.
those things are really important. Now let's talk a little bit about the actual advocating, right? Because people are like, what do I say? And how do I say it? And how do I not look like a needy person? Or, so from your perspective, Rebecca, what would you recommend for people? How can they actually advocate once they're sitting down at the doctor's office? They've already prepared, they already have their questions, but now they're getting pushback from the doctor saying, we don't think it's this, or you don't need that.
Yeah, I think that's a good question. I would say you're prepared, you're getting the pushback, basically requesting. If you've already done the research and you know there's a certain test, specifically requesting. Or if they're saying no, like saying, well, you're saying no to this, what can you do? Right? Because this is not satisfactory to me. And so again, just like adding in, you can ideally assert and request and just continue to ask for more information. And I would say, too, again, paying attention to that response, because if I'm getting this response repeatedly, even, I'm trying all these different attempts, I'm making all these different attempts to advocate for myself, and I'm leaving feeling unheard, I'm leaving feeling undervalued, disrespected, whatever it is. Well, that's information for me as a patient, as an individual to say, okay, I'm not getting what I need from this provider or from this office. And not everyone has the means or the options to just go to a different provider, but if you do, looking at those opportunities, and again, connecting with people, like putting out an all call on social media to for recommendations, and just hearing from people where have they had different and better experiences. So I think there's the advocacy that happens in that doctor's office, and then there's the broader advocacy of, okay, in this broader system, how do I advocate for myself? And sometimes that means saying like this relationship with this provider is just not working. Even though I'm trying my best and I'm doing all the things I can to try to advocate, this isn't working, and where else can I try to seek care?
Yeah, that's such a good message, Rebecca. I feel like if you leave your doctor and you are not feeling heard, it's not you. Like you need to change your doctor,
Yeah.
right? Because you need to have someone who is actually taking your complaints seriously. And the other piece of it, of the advocacy, besides the immediate advocacy and then the bigger picture, there's also long term in that keep touching base, keep being the squeaky wheel, saying, hey, by the way, I followed your protocol. It's the same. Nothing is happening. Nothing is changing. Nothing is improving. Like instead of just dropping it and going on with life, with your pain, with the symptoms, because a lot of times, we may have symptoms that we can live with. That doesn't mean that we should continue to live with them, or it doesn't mean that we shouldn't look deeper to find out like how can we heal, right? And so I think it's important to be the squeaky wheel.
Mm-hmm.
And sometimes it's not, you don't have to be rude. You can just say, hi, doctor, I just want to let you know I went through the 6 months of PT and I'm still in the same place that I was 6 months ago. Like touch back base with them and let them know instead of just saying, well, I did it. I guess there's nothing else to be done and moving on. Because I've made that mistake, not so much conscientiously, but I just like went through what they told me to do. And then I just dropped off and continued to live my life. And then realized, wait a minute, I'm still not getting any help. I better go back and let them know.
Yeah.
So you want to like play the long game to say, let me keep letting them know, because guess what? A lot of doctors don't follow up with you. They don't say, by the way, you've done your PT. How are things, right?
Yes. And I think that's so important because when I think of if we were to truly create human-centered systems, there would be this type of follow-up built into it. But again, looking at the system as it is, we know that piece is often missing. I'm trying to think of a single example where there's been a follow-up without like, oh, we are going to schedule you a follow-up visit, right? And that's just on the books. But yeah, I think that's such an important point because that is a form of power and agency that we have is to, again, we are living our lives every day. We are living in our bodies every day. And it doesn't have to be any, bad intent from the healthcare provider. It can just truly be the system is not set up to follow up and they don't know unless we tell them. And so, again, it's like they're not mind readers, just like in relationships, right? Our relationship partners are not mind readers. If we have a need, if we have a problem or an issue that we're dealing with, it is up to us to actually communicate that. And, that's us being fair to the provider. And then how did they respond to that and receive that and follow up on that is on them, right?
Yes. Now, I want to bring up something that is near and dear to my heart and still within the same topic is like perimenopause and menopause and how women aren't getting the help that they need and what can they do, because a lot of times people just either suffer in silence because they feel like, oh, this is what happens, right? Or they just don't really know what to do. So they're like, yep, I'm suffering. And they might tell their friends and their family, they're like, I'm suffering. But then not realize like there are things that you can do. Talk to your doctor to try to mitigate all of the symptoms that you have when you're in perimenopause or menopause.
Yeah. And I don't know, I think that that's a whole other piece of this because you're offering up that specific example. And there is so much when we just look at the research, right? Coming back to the systemic barriers and, issues that exist is just the dearth of research on either particular medical conditions that relate to women or other marginalized groups, or people being excluded from research based on the race or gender or sex that they belong to, right? So it is, I think this ties back into, and maybe I'm zooming out too much, but what you mentioned earlier about oh gosh, I'm losing my train of thought. But I had it and now I've lost it. Well, you said something really profound earlier. But oh yeah, this earlier, like speaking to this power dynamic and this idea around experts, right? Expertise. I think there's so much going on in the broader society and culture around these narratives that are framed as either or. Either we respect, science and experts, or we just totally go off into pseudoscience and anecdotes and we lose the plot. But to me, it's so important to make space for both of those things. We have to merge, in my opinion, we have to merge the research and the expertise, and like you said, the patterns and the likelihoods of what things are with the actual lived experience. And again, I know I'm kind of not touching on the perimenopause thing so much, but another example from my mom. My mother in the 1970s was prescribed a medication that ended up causing severe hearing loss for her at a relatively young age, like younger than she would experience normal hearing loss from aging. And so what this created was, for me, when I got diagnosed with my illness and I'm just told, okay, you're going to take this medication now. Okay, well, what is this medication? And what are the side effects? How long has it been prescribed to people? How much do we know about it? I'm not trying to be a resistant patient. I'm not trying to be anti-medication, but this is a lived experience that my mother had that has informed the way that I view medication just being prescribed without us even being able to have a conversation about it. And so that to me was another example of, we have to, respect what are the lived experiences that people are bringing in to the healthcare space as patients. And then also, how can we merge that with whatever expertise or research is out there? Because there are limitations to research, and it is also very important. So, finding that both and. But yeah, the perimenopause and menopause stuff, I mean, this is something that I'm going to be coming into, or maybe I'm already coming into, and have no conception, right? I don't even know. And so it's like, oh, I need to be researching that more. What information is actually out there? I mean, yeah.
Yeah, I mean, it has not been my experience that when you go to the OBGYN, they're like, here's all the education. Let me tell you all about it. You're sort of like walking around in the dark, and you're like, maybe if you say something, they'll help you. But if you say nothing, then they don't help you. So it's been one of those things. But also, I want people to consider that even though there are medical experts, there's so much research that we don't really know what our personal doctor has been focusing on regarding reading what the research is, right? So you might just be like, oh, there's lots of research, but there's so much about every kind of symptom and disease and whatnot. So you can't really expect one person to already be up to date on every single research medical thing that's happening. And so I have found that there is a difference in terms of the knowledge regarding HRT, hormone replacement therapy, doctor to doctor. Some doctors are like, no, we don't do that. Some doctors are like, oh, it's the cutting edge new thing. Some doctors are like, oh yeah, in Europe, they're already doing it. So you get different information based on who you go to.
Yeah.
And so you want to make sure, I'm not saying cherry pick the one that says what you want, but you just, if someone says no, you might want to just at least go and figure out if there's someone else who knows more about it or who has the most up-to-date research, right? Because otherwise you end up suffering.
And I think this is making me think about how trust plays into all of this, because I'm going to trust you more if you tell me. So I'll give an example that relates to what we're talking about. When I was initially diagnosed, I mentioned I have a GI disorder. So my first two providers that I worked with around my diagnosis were broad GI specialists. I ended up switching to a clinic, and I'll give them a shout out. It's the Crohn's and Colitis Center here in Baton Rouge, Louisiana. It's been like night and day. And one of the things that's so special about this clinic that I go to now is they focus specifically on these two GI disorders, Crohn's disease and ulcerative colitis. And they talked about that to me when I, came in for my first appointment, which is that most GI doctors, they are having to focus on such a wide variety of illnesses and disorders related to, the GI tract and system. And so they're not focusing specifically on this disorder that I have necessarily. And so being able to go to a place where this is their specialty, it was just a total different culture. And one other thing that they would do is they do spend time with me. And I don't know how they manage it, with the insurance and the billing and all the things, but they are very good about, I'm going to spend time with you. I'm going to ask you, do you have any more questions, until you don't have any more questions. And I've had, providers there talk to me about, well, here's the research that's coming out about this and that. And so they'll even share with me the things that they're looking at and bringing that into the discussions. And so to me, it's like, it builds trust more for me as a patient if you're telling me here's what we know and what we don't know. And here's, based on all the things we know, what we would recommend, and here are the other options, and let's talk about it. And let's collaborate to make that treatment plan. Instead of just, oh, well, we know everything and I know everything and here's the one way to do it. And, that's all she wrote. So, recognizing that when we're talking about leadership, it builds trust if we acknowledge the limits to our knowledge and we can co-create solutions. And I think the same thing applies in the healthcare space and relationships between patients and providers.
Absolutely. And I think that a really good provider is someone who, like you said, feels like you are part of the problem-solving team.
Yes.
Right? It's not like, oh, I know everything, you know nothing, and I'm going to show up as the expert and tell you everything. It's like, okay, you have some amount of knowledge, which is what your body is doing, what you have been suffering, and I have the medical knowledge. And so you want to team up together, work together. So you want to find a provider who includes you as part of the problem-solving team. That's the ideal scenario, because then you don't have to spend as much energy constantly advocating to get what you need, because now you're part of the team, right?
Totally. I think that's so well said. And I think, people listening, that's going to be a good area to reflect on. Like, do I feel included? Do I feel like I'm a part of this? Do I feel respected in this process? And I think, that's so fundamental. These are fundamental questions to ask ourselves and reflect on when it comes to the providers that we choose and stay with.
And, another thing that you mentioned earlier, I want to circle back to it, was asking a lot of questions. And I know that there are people who feel like, oh, I don't want to be the person that's like, the doctor's going to go home and be like, oh, yeah, I had this patient, Alice, she came in and she really bothered me because she had 50 questions. But that's how you advocate for yourself. You want to not only educate yourself by asking those questions, but you want to let them know that you are just as invested as they are in determining what is wrong with you or what are the things that we can do to get me back to good health, right? And you can't do that if you don't ask enough questions, because those questions are coming from your lived experience. It is not a question that anyone else can ask because they don't have your lived experience, right?
And I think this connects back to, your example about menopause and perimenopause. There are so many things that happen in our bodies and we have no idea what is happening, why it's happening. And not everyone might be interested in that, but I am a person. Like, that's part of who I am as an individual. I am a curious person and I want to know. And I'm not trying to waste anyone's time, but it helps me. And also, it's a way, I think, for me and other people like me, it's a way to help build buy-in, because I understand the why. I understand why you are, prescribing this thing or recommending this treatment plan and course of action. And again, that is what, for me and my personality and who I am at my core, that is what helps me to feel included and a part of this and bought into the process. So yeah, I think it's interesting how much asking questions also can be stigmatized and treated as something that's unacceptable or disrespectful when it's curiosity. And I always look back to when I got my diagnosis and I'm, in the room with the doctor. I mean, she basically told me kind of 3 sentences or 3 things about this diagnosis that I had never heard of. It was all new to me, but this is something that I now have. It's incurable. So this is the rest of my life. I didn't get a brochure. I didn't get anything from that doctor's office to help me learn more. But one of the things that she told me is this can be an expensive illness to have. So there were 3 things, right. 2 or 3 things I was told, which is, inflammation, blah, blah, blah. If you don't take the medicine, the inflammation can get worse and it can be a very expensive illness to have. I'm like, okay, great. Now what? So yeah, I think coming back to how are we educating people when they are diagnosed with something? how, whether it's a brochure or, online digital resources, people deserve information about what's going on in their bodies. And so that's something that I think is really important. And again, when the system is not set up to proactively give us that information, then of course we have questions. And that I think is another thing, is how is our provider responding to us asking questions? Are they treating it as an annoyance, as a problem that we're doing that, or do they welcome those questions and respectfully respond and provide more information?
Yeah, so if you have a doctor who is not respecting the fact that you're asking a lot of questions, instead of just saying to yourself, okay, I'm going to play the good patient, I'm going to shut up and not ask any more questions, you probably should go home and look for another doctor. Because ultimately they're not doing you any favors by tamping down your questions, right? You can't advocate for yourself properly if you are encouraged to be silent, if you're encouraged to just only listen and not be curious and not ask questions, right? I had back pain. I mean, I'm still dealing with this pain, but now I kind of know what is going on. But many years ago, when I first had it, my doctor said, oh, you can just take ibuprofen every day. And I was like, I don't want to take ibuprofen every day. He said, you can take up to like 2,000 milligrams a day. It's fine. And I was like, okay, number one, I have a feeling that's going to mess up my GI. So I don't want to do that, right? I didn't say that, but I knew this already because I had read something somewhere saying like, you don't want to do this because it's going to adversely affect you elsewhere. And so I said, okay, is there something else I can do? Like, I'd rather not take the ibuprofen. And I got a lot of attitude and a lot of pushback. He basically said, you came to me. Are you going to take my advice or not? He said, the advice I'm giving you is med school 101. If you have pain, take your ibuprofen. And I was so alarmed that he was giving me this kind of attitude, this kind of behavior coming at me, and that he was not accepting of the fact that perhaps I did not want to medicate myself daily using painkillers. And turns out that I had some kind of a birth defect that was causing the pain. So unless I fix it some other way, it's like I would be taking some ibuprofen forever and probably messing up my stomach along the way.
Yeah, and I think that's such like an interesting example too of one thing that I experienced a lot early in my diagnosis was we are only going to treat the symptoms and we're only going to talk about the symptoms. We're not going to talk about why this is happening. And so that kind of surface level thing, I think that's another values thing, that's another personality thing. Like the way my mind works is I'm a root cause person. And so yes, I can accept that in the world as it is, I have this disorder, this disease that I have at this point is essentially incurable. I can accept that, but I still want to be able to understand, how environmental factors are, I want to be able to have those conversations and understand that. And I want a healthcare provider who's able to speak to those things as we are also, working in the world as it is to treat the symptoms. And yeah, so I think it is an issue because sometimes there might be something deeper that we're not looking into that could actually be resolved, or there could be a different treatment option. And is the doctor even listening or asking, okay, why are you resistant to this thing? And really getting curious about that. Because again, I think people don't necessarily want to be resistant or quote unquote non-compliant for, just to do it. There's usually an underlying reason. And so being able to even get curious as providers to understand what are the hesitations, what are the concerns, and is there a way to mitigate that, or again, present a different option for moving forward. So
absolutely. Yeah. And definitely do your research. Definitely, ask people who are maybe in your spheres who are also medical providers, ask their opinion, like you said. Join support groups where people have like the similar kind of symptoms so you can ask questions. I mean, on the one hand, you don't want to show up and be like, hey, my friend Dr. Google said X, Y, and Z, right? So you don't want to be that person, but you still want to be the kind of person to say, this is like, you have to keep digging deeper, because like we have not figured out why I'm having this pain or why this thing is happening to me. And a lot of times you're the only person that's going to ask them to please dig deeper, because you're the person who's most invested in your health, right? Clearly the doctor who told me to take an ibuprofen, all he cared about was the symptom. Let's make the symptom go away, take your ibuprofen, and now we don't have to hear from you.
Mm-hmm.
Right? But I, not only did I want to save my GI, I also wanted to find out, no, what is the root cause of this pain? How can I fix it, whether through physical therapy, surgery, other modalities, right? And so you have to ask all the questions. You do have to push. You don't have to be super pushy, but even if it's long term, where you just call every 2 weeks and let them know, here's an update. It's gotten a little better, but not quite what you told me, right?
Yeah.
And that sort of thing. Because if you don't, there's no one else who's going to call them to tell them.
I'm literally now, like literally this week, I have had to follow up again with a doctor's office because I basically was given a referral based on some lab results. And so there's something that needs to be looked into. So I was, given this referral. They reached out to me once. I've called and left, I think, 2 voicemails at this time over the course of maybe a couple of weeks. And I haven't gotten a call back to schedule an appointment. And so I'm at that point literally today where it's like, okay, I need to, yes, I'm going to continue calling, but I'm also going to reach out to my doctor that referred me to let them know I've been trying to make an appointment. And so far, it's been unsuccessful. And so they at least are updated, and I'm not throwing anyone under the bus. Guess what? This is my health, and I'm just going to let you know and just see what they say. They might just receive the information, and I still know it's on me to follow up on this, but they might be able to also take some action to get this advanced.
Yeah, because you can have them sort of advocate on your behalf, because
Right.
then they can send a message saying, hey, I sent you this patient 2 weeks ago. Can you please put her at the top of your list today? Right? And so there are ways to get other people to advocate on your behalf in instances like you're talking about, where you followed up and followed up and followed up, and there's like nothing coming back.
Yeah.
Right? Don't give up. The bottom line is don't give up. I don't know. What are some last tips or advice that you want to give to people about this, Rebecca?
Well, I think this may be a little out of the box because it's not just advice for patients, but for providers is I also think we need to recognize that behavior change is a process. And what I see a lot of times in the healthcare field and medical field is like when we're talking about people being given a treatment plan or being prescribed something. I'm being prescribed something. Let's say it is taking a pill every day. Well, now I have to do that every day. That's actually a behavior change. And I have to understand why this is important for my health. And so I think just giving people more grace and understanding that this isn't just about giving an order and having people follow orders. This is about approaching change as a process, and treatment plans, prescriptions, those are changes in people's lives. Diagnoses are changes in people's lives. How are we supporting patients through the process? And how are we as patients also giving ourselves grace to recognize that, okay, we are now adjusting to this diagnosis or this, treatment plan, or and recognizing that our physical ailments connect to our mental health. So how are we also seeking out resources to navigate the impacts on our mental health when our physical health is struggling? So I think that's just kind of the final thing, is viewing all of this as a process and then taking care of our whole selves, because it can be really stressful to self-advocate. So coming back to that, like, how are we de-stressing, finding support, and just getting through it the best we can?
I love that you mentioned that. And to that point, the other thing that I find in my life when I'm trying to change some kind of a habit, and it's related to my health, especially when it's a habit where you're like, oh, you need to cut out sugar, or oh, you need to cut out gluten, or oh, you need to cut out everything, right? I think that one of the things that I have found that is effective for me is to set a start date. So not just be like, oh, I'm going to do it tomorrow, because I might not be emotionally ready to actually implement the thing, even though my brain says we're starting tomorrow. So to give yourself however much time you need. So sometimes I'm like, I need 2 weeks to get ready. And that 2 weeks is me mentally and emotionally getting ready to let go of a lot of things that are ingrained as habits. And so for the 2 weeks, you're spending your time thinking about it, thinking about getting ready, getting ready. So it's all done internally. But then when you start, you have a better success rate because you're bracing for the start. It's kind of like, oh, I'm going to do this marathon. I'm going to train for it. You don't just say, oh, Rebecca, tomorrow there's a marathon. Let's go, because there's going to be guaranteed failure for me and you because we did not even prepare. So to prepare emotionally and mentally for these big habit changes, even if it's giving yourself 5 days to say, let me just mentally get myself prepared, will help you tremendously.
I couldn't agree more.
Awesome. Well, this has been so lovely. The time has flown by. Thank you so much, Rebecca, for being on the show. And if people want to work with you, how can they reach you? We'll have all of Rebecca's information in the show notes, but what's one piece of contact information you want to share?
Yeah, so my website is culturework.co. And really anything can be accessed through there. So my blog can be accessed, more information about my work, my socials. So yeah, if anyone is interested in learning more about my work or about me, head over to culturework.co. And yeah, and I also, if anyone's interested in connecting, I love connecting with folks. So
You're on LinkedIn, right?
What?
You're on LinkedIn, right?
I'm on LinkedIn, yes. So LinkedIn, Instagram, and yeah, publishing monthly on Substack. But all of that you can get to through my website.
Awesome. Well, thank you so much for being here today, Rebecca. Thank you, listeners, for tuning into another very, very interesting topic. And hopefully, listeners, you'll share this with people who are struggling with the medical system, who need a little bit of help advocating for themselves, because I think this is definitely something that touches most people.
Absolutely.
All right. Until next time, everyone, thank you so much.